the purpose of today's workshop is to teach you a little bit about preparation steps for birth and how chiropractic can help so much with that, but also how you can be a lot more comfortable throughout your pregnancy, and what kinds of things you can do at home to help your adjustments be more effective and to be more long lasting. So there is a textbook of obstetrics that all the obstetricians have to learn from. It's called the Williams Textbook of Obstetrics. And in that book, Dr. Williams talks about dystocia, which means difficult births, and the causes for dystocia. Births that are stalled, or that are hard, or that are way too long. And he says that there are 3 possible causes for these difficult births. And all 3 of the causes start with a P. And you see them right here. He talks about the power, the passage, or the passenger. So the reasons for dystocia can fall into either one or more of these 3 things. And I want to talk to you about a little bit about each of these things and how we address them in chiropractic. So let's talk about the power first. When you hear the word power as it relates to birth, what is it that you think they're referring to? You can unmute yourselves if you want to talk about this. So what is the power in birth? Where does the power of birth come from?
Contractions?
Yes, the contractions. And where do contractions come from? What is causing them?
The uterus or oxytocin?
Okay, the uterus, yes. Oxytocin, yes. But oxytocin is what triggers your own body's mechanism to start the contractions, which ultimately it is the uterine muscle that contracts. But where is that power coming from? Why is your uterine muscle contracting? You give up? Well, the uterine muscle contracts because your brain is sending messages to that muscle, telling it to start contracting. Your brain picks up on the hormones that your baby is going to start sending. When the baby is ready to be born, hormones are going to come out of your baby's body, and your brain is going to pick up those hormones and it's going to say, this baby is ready. And the brain is going to send messages that go from your brain into your uterine muscle to start contracting. And the nerves that come out of the lowest part of your spine, let me ask you this. I'm moving the little square where the pictures are of all of us. Is that now in the middle of your screen? Am I covering something?
No, the presentation is still showing.
Okay, perfect. Because I want to be able to see you straight instead of looking sideways because it was in the corner of my screen. Okay, so here is a picture of a spine. These are the lowest bones in your spine, and right here are your ilium, which is the pelvic bones. See all of these yellow strands that are coming out? Those are the nerves that come out of your spine, and they literally go right here into your uterine muscle. You can see them right here. These nerves leave your spine through some little windows, tiny little openings on either side of your spine, all the way from here to here. You have those little tiny openings between the bones of your spine, and the nerves exit from the spinal cord and they come out through those little openings. So when they come out from the lowest part of your spine, they come around and they feed into the uterine muscle. And that is how your brain tells your uterus when to contract. So imagine this. Your brain is going to tell your uterus when to contract, how often to contract, and how long each contraction is going to be, how long and how strong. if you look on this side picture right here, you can see how those nerves are coming from the lowest part of the spine and flowing right into the front of your body. And when your spine is in perfect alignment, the little openings that are on the sides of your spine, all the way from top to bottom, they are perfectly big and spacious to allow the little nerves to come through like that. But when your spine becomes misaligned, those openings can close down and they can cause compression on the nerves that are coming out from that lower part of your spine. So what happens is that the messages that are being brought from the brain into the uterus can become interfered with, and the uterine muscle it's possible that it won't get the strength and the frequency of the messages that your brain is trying to send. And because of this, the birth can get stalled. So women who are under chiropractic care, this is one of the most important things that we check for, is to make sure that we have perfect alignment in these lower spine bones right here, so that we can maintain that opening as big and as patent as we can, so that there is nothing causing any compression on the nerves. We go to a lot of births that sometimes doulas or midwives will call us to because of a stalled birth. And very often, as soon as we adjust, sometimes it's nerves or bones that are in the neck, and sometimes it's the actual bones in the lower part of the spine. But these births pick up almost immediately after an adjustment. And in this case, that is the reason why, because if there's any kind of interference to the transmission of those nerve impulses, then those messages are not getting there the way they're supposed to. Here's a picture of what a misaligned spine can look like. And on the left, you can see that there is the sacrum bone, which is this triangular shaped bone that sits on the bottom of your spine, on the back of your body. And then this is the left hip bone, and this is the right hip bone. And if you look to see, the right hip bone is nicely attached right here to the sacrum. But on the left side, what I did is I literally just opened up that joint so that it separated the sacrum from the ilium. And then I took that pelvis and I put it as if this person was lying on her stomach. That's why you see right here is this is the front of the body and this is the back of the body. And you can see the open joint right here, which is this one on the left right there. And I just want you to pay attention to the opening of this birth canal, because this pelvic opening right here is actually where this baby is coming through. If this bone was not misaligned the way it is right here, you would see that the opening on the left here and the opening on the right here would be exactly the same. They would be symmetrical and they would be big and open and big enough for a baby to come through without any problems. However, if you look at what's happening right here, because of the misalignment that I caused right here by opening that joint, now you have a really big space on this side. But do you see how narrow this is right here? Because the sacrum is actually taking up some of the space that this opening should have. So this birth only has this much space, really, because a baby is not going to be able to come through here. This is too tight and too narrow. So now you lose pretty much about a quarter to a third of space of the opening that you should be able to have for a baby to come through. So this is the second P that Dr. Williams was talking about. It's the passage. The passage is the bony pelvis, allowing big enough space for the baby to slide out at the moment of birth. So when we make an adjustment to your pelvis, what we're trying to do is we're trying to bring better alignment and balance to these joints right here, so that when we look at your pelvis this way, it will be more symmetrical and more balanced and more aligned, so that your baby can actually get into the head down position and can get into a really ideal position for birth. at the moment that is necessary. So this is how chiropractic affects the second P. So the first P was power, and we affect that by making sure that all the openings where the nerves are coming from are nice and patent. The second P is the passage, and this is how we affect the passage. The third P is the passenger. Who's the passenger? I know you're saying the baby, although I can't hear you, but the baby is the passenger. And absolutely, the baby gets affected by all of the things that are happening in your spine and in your pelvis. The passenger gets affected because if your pelvis is misaligned, it's going to be hard for the baby to get into an ideal position for birth. Here is a picture of what we don't want to happen on the left side. This is where the baby's butt is down instead of the head being down, which is what the right side is showing you. This is the ideal position for birth. You want the baby with the head down, with the spine towards your left side. And the left side is what we call a breech baby, which is not a good position. In the state of Florida, you will not be allowed to have a breech vaginal birth. So many of the moms that come to me that have breech babies because they're planning a home birth or a birthing center birth, and they don't want to end up in the hospital with a C-section. And there are two chiropractic techniques that are very famous for, I'm going to put this on quotes, turning breech babies, because really we don't turn a baby. The babies know when to turn and how to turn, but sometimes they're not able to because there's too much interference from bony or soft tissue structures in the pelvis, and the babies get stuck in a position because they can't quite move from there. So after we apply the Bagnell or the Webster technique, we create balance, we create nice alignment in the pelvis. So if you picture that, that bony pelvis that I showed you in a couple slides ago, now we want that opening to look like this. And those babies get into the perfect position for birth when we are able to get your pelvis to look like this. So for those of you who start your chiropractic care earlier on in the pregnancy, you have the biggest advantage, because if your pelvis is aligned from the beginning, then your baby is going to have a perfect opportunity to get into a really good position for birth. Sometimes moms wait until the baby is already breached at 32 or 33 weeks. That's when your baby is supposed to be head down, is at that stage. And it gets harder for us to be able to align your pelvis when the baby is occupying so much more space. When your baby is tiny, we can do a lot of changes of your pelvic alignment. But as the baby gets bigger and bigger, that becomes harder to do. So one of the advantages of getting chiropractic care earlier on is that your pelvis will be aligned when the baby is ready to make that turn down. Okay, I'm going to go through some information about things that you can do during your pregnancy that are going to help you to have the best pregnancy as well as the best birth. And I don't know how many of you are familiar with the Spinning Babies website. It's the address is right here, spinningbabies.com. And if you go on that website, there is lots of really great information about preparation for birth. The part that I love the most are these three things here called the Three Sisters. And I'm going to go over them because this is something that you can start doing at about 20 to 25 weeks in your pregnancy. And all of them contribute to you having a much easier pregnancy and a much quicker and easier birth. So let's talk about the first one. This is called the side-lying hip stretch. And it's a release of the front and the back tissues of your pelvis in order to create less stiffness so that your adjustments can be much more easy to perform as well as to hold. So the way that you do that, and I'm just gonna quickly do this because on the Spinning Babies website, they have really great explanations. But basically, you're gonna be on your side. You probably need to have the help of one person. Here you have 3 people, but I think they're more observing. You lie on your side on the edge of your bed or your couch. You straighten your upper leg, you bring it forward, and you let it drop off the edge of the bed or the couch so that it hangs kind of just hanging in midair. And what you're going to be doing is you want to feel the stretch in your glutes and in your hamstrings. That's what this position is going to allow you to do. Once you kind of hang your leg off the edge, you're going to be stretching the back portion of your pelvis and your leg. The next stretch is you're going to turn the opposite direction, and that's what you're seeing right here. So you're still kind of in the same position that you were before, but instead of hanging your leg forward and letting it drop off the edge, you're going to bring your leg backwards, and you're going to either let somebody stretch it like this, or you're just going to place it behind the other leg. And what you're doing here is you're stretching the front part of your pelvis, all of your hip flexors, including the psoas muscle, which I'm going to point to right here. This orange muscle that you see right there is called the iliopsoas muscle. And it's one of the most important muscles that creates misalignment in your pelvis. If you can keep that muscle released and relaxed, your pelvis will not misalign as much. Do you remember every time that you come in to get adjusted that I ask you to give me your arms like this, and I look at the length and I look to see if the fingers come to the same length or if one arm looks shorter than the other? This is what I'm checking for. I'm checking to see if one of these 2 orange muscles here is pulling more on one side than the other. And that's how I can check. When your arm looks to be shorter than your other arm, it means that the psoas muscle on that side of your body is pulling down on your entire upper body like this, and it makes your arm go short. So if you look at what happens here, imagine that this muscle here is shorter than that one. Can you see how it would pull your spine towards that side, and it would actually cause this part of the pelvis to become misaligned? Well, the psoas muscle is the most powerful muscle that can and does misalign your spine. So doing this side lying stretch on your psoas muscle will keep you from having to have a misaligned pelvis. On the bottom is another way that you can stretch your psoas muscle. And then there is the last way, which is what I think it's called a runner stretch, where you put your leg back and then you just stretch backwards like that. And if you have questions about that, well, let me see if I can do it here. I was going to say, I don't think I can demonstrate, but maybe I can. Can you see me like that? Okay, you put your leg back and you bend your front knee, and then you just bring your arms like that. And you're stretching this psoas muscle right here, the one with the leg that's going backwards and the leg that's straight. If that didn't make too much sense, write it down and ask me the next time you're here, and I'll show you how to do it. These are just different ways to stretch that same muscle. So anything that stretches your iliopsoas muscle, you want to do, starting probably at about 25 weeks of pregnancy. Do it on an everyday basis. Keep those 2 muscles as released and as relaxed as possible, and that's the idea. Okay? The next thing is called a forward leaning inversion. And an inversion is the word that is used to describe when your head is below your heart. So it can be done in a lot of different ways. Right here, the way you're seeing it on the screen is just on your couch. You can also do a downward dog position. For those of you who have ever done any yoga, a downward dog position where you are literally like an inverted V is also a great inversion to do. You can do inversions that are even softer, not softer, gentler than this one. by just getting on your hands and knees and putting your chest down on the bed, for example, or on the ground, wherever you are doing the hands and knees position. And so that is probably the least, the most gentle inversion is just being on your hands and knees and just bringing your head and your shoulders down to the ground. This one here would be the next gentlest, and then downward dog would be the least gentlest. But in the past, it was thought that you would only do inversions if your baby was breech. But now we know that inversions encourage the baby to come away from your pelvis when you're in the inverted position. But then when you come back up into weight-bearing position, your baby just gets into a nicer and nicer position. Every time you do an inversion, your baby will get into a better and better position for birth. So definitely in the last 6 weeks of the pregnancy, you want to be doing inversions all the time. A minute, 30 seconds to a minute is all you need to do, but they are extremely useful to help babies to get into ideal positions. If you look on the right side of the screen on the bottom, these are the contraindications, which means that you would not do inversions if you have any of these things. And even if some of those don't sound like you would know whether or not you have them, if you had them, you would know it. Your doctor would have already told you that you have some of these if you had them. Okay, and then the last of the three sisters is called rebozo. And rebozo shifting is an awesome thing to do during the pregnancy as well as during the birth. It is extremely helpful to release tension, which causes pain during the pregnancy, and to release tension during the birth process. So obviously, you need a partner in order to do rebozo shifting. The rebozo is actually the scarf that you see right here in all of these different pictures. That is called a rebozo. And it is a Mexican midwife technique that has been used for generations to create comfort during birth, comfort during pregnancy, and also to turn babies. So we're not going to talk about how to turn your baby with a rebozo, but the Mexican midwives actually turn breech babies and transverse babies by doing some of these techniques. The way that I want you to think about using it is just for comfort. And if you look at on the left right here, basically what she's going to do is by holding on to the ends of the rebozo, she's going to create this kind of motion by pulling on one side, alternating with the other side, and creating a little bit of a shifting kind of movement right here on the pelvis. If you look here, when she's on her hands and knees, the rebozo is actually around the baby, and you can do the same thing. You're going to use your arms to just gently pull back and forth on both ends of the rebozo, creating a little bit of a shifting movement here. This one, look at that, it's actually an inversion position with rebozo. That one probably is the one that they use to turn breech babies, so you don't have to do that one, but this one or that one are extremely helpful and really, really delicious to make you feel so much release of tension in the pelvis and in the lower back. So they're good for lower back pain, for hip pain, for discomfort in your upper back, just anything that doesn't feel good, do a rebozo shifting and it'll really make a difference. At the bottom here, this is actually a technique that is used in labor. So if you want to talk a little bit more about that, we can do that later. But for now, during the pregnancy, just use it as a pain relief technique that is very effective. Okay, I'm gonna go over a few things that are gonna also make your pregnancy be a lot easier and your birth much faster. The first one is no slouch on the couch. And what that means is that you don't want, let me see if I can demonstrate this here. You don't want your body to be rounded forward like this, especially in the last 4 weeks of your pregnancy. Imagine that there's a string that is always pulling your body upward, and you want your body to be in that position. It doesn't matter if you're standing, if you're sitting, if you're lying down in bed. You don't want to round forward like that. So sitting on the couch to watch TV in a really slouch position like that is not good, because what happens is, okay, right here. This is called your pelvic inlet. It's the top of your hip bones. And the baby, most of the pregnancy, the baby is going to be up here. But in the last 4 weeks of the pregnancy, that baby is going to start to come down into your pelvis. And you want the pelvic inlet, which is here, to be really nice and open. If you slouch like that, you are closing your pelvic inlet. If you are nice and tall, you are opening your pelvic inlet. So think about that, especially in the last month of your pregnancy, how you want your pelvic inlet to be open so that baby can start descending into the pelvis. And anything that you do that causes you to go forward and slouch is going to close that. So no slouch on the couch. Splaying of your legs. When your knees start to come apart, the pubic bone, which is the front joint that's in your pelvis. So the joint that is right here, that sometimes I palpate on you, and that can be pretty tender. We want that joint to stay really nice and closed like that. Sometimes because of pregnancy hormones, the joint starts to get a little bit wobbly and a little bit unstable. And if you cause too much opening of your legs, what happens is that the pubic bone can start coming apart, like separating. So in pregnancy, you want to try to always keep your knees kind of close together. And when you move around in bed, when you get in and out of oops, our meeting is going to end in 10 minutes. Okay, I think I can do it. Oops, what happened here? 1 second, I went to the wrong one. Here it is. So we want knees together and not splaying, because that tends to cause separation of your pubic bone. Okay, carefully care for toddlers. For those of you who have little ones and you hold them and you prop them onto your hip and you walk around with your child on your hip, that causes your pelvis to go like that, and it causes misalignment of your pelvis. So pay really close attention to how you're holding your toddlers. You either want to hold them in the front, right here. That keeps your pelvis nice and balanced and even. You don't want to hold them sideways and prop them on your hip right here, because right now your pregnancy hormones cause your pelvis to be very unstable, and something like that can cause a really bad subluxation in the pelvis. During birth, I want you to remember this. If your mouth is relaxed, your perineum is relaxed. Your perineum is actually the tissues that are on the bottom of your pelvic floor, all of that. We want everything to be relaxed. So I want you to try something right now. I want you to tighten the muscles in your perineum that would stop the flow of urine. So the Kegel muscles. Can everybody do that? Can you feel those muscles? Okay. So now I want you to try to blow raspberries through your mouth like that, and see if you can still keep your perineum tight. And you'll realize that as soon as you start blowing those raspberries, your pelvic floor just goes, it completely relaxes. So for those of you who are partners that are going to be there for the birth, remind these mamas to blow raspberries, because what happens is when you start to feel the contractions, your tendency is to tighten everything. Because of pain, you tighten up. You don't want to tighten anything, especially your pelvic floor. So blowing raspberries is going to relax your pelvic floor, but somebody has to remind you to do it. Positions during birth. Most of us grew up looking at moms lying in a hospital birth, in a hospital bed on their backs. That is the worst position that you can have for birth. The best position for birth is one where you're not on your back, because being on your back keeps your sacrum from being able to flare out. Everything in your pelvis needs to flare out when the baby's coming. And if you're lying on your back, your sacrum is stuck right there against your bed or the surface that you're on, and it doesn't have any room to move. So you want to be on your hands and knees. You want to be on your side. You want to be in a standing position. You can put one leg. You can be standing with one leg on top of a chair. Anything except your back. So that's something that is something you have to talk to your doctor about that. But being on your back is the hardest position to birth. The last two things I want you to know. Your body is making the contractions. They are not going to be stronger than what you can handle. When the contractions are as bad as you think you can handle, they probably are not going to get any harder. They're just going to come closer. So if you think about that, I'm handling this, you can say to yourself, this is as hard as it's going to be. It's going to come closer, so I'm going to relax in between contractions. So just remember, your body is the one responsible for making those contractions. It's not going to do something that you can't handle. So don't be afraid of birth. The last one is your body is making this baby, and it's not going to make a baby that's bigger than you can handle. So there's plenty of space for the baby to come out. These are two of the things that bring a lot of fear to moms: the contractions and the size of the baby. Okay, what about babies? So just as chiropractic is awesome for moms, chiropractic is even more awesome for babies. We encourage our patients to get their babies checked as soon as possible after the birth, as a gift for being, as a birthday gift, a gift for being born. We do a checkup on the babies, and that'll save you guys $150 on the price of an examination. And some of you will qualify to have free baby care, and that depends on what kind of care plan you signed up for, how long your care plan was for, if you have postpartum care or not, different factors. So you can ask us individually to see if your baby qualifies for free baby care or not. But whether it's free or not, we encourage babies to get checked and to be adjusted as soon as possible, because a lot of the things that may happen to a baby happen during the birth process. And here's an example of something that can happen to a baby, is being pulled by the hands of an obstetrician or by forceps or by vacuums. And this is an extremely traumatic thing for a baby. And these babies come out, nothing is bleeding, nothing is fractured. So there's not a person who is saying, we need to do something about this. But chiropractors are the only specialists that even talk about this kind of stuff, and that can check the babies to see if something needs to be done. The other thing that happens to babies after birth is what you see right here, and it's called container baby syndrome. And it is putting our babies into too many containers that cause them problems in their spine, and that all of these things I'm going to talk a lot more about during the baby workshop, which I think all of you are also scheduled to attend. But some of the things that we see on babies, you can see right here. These are little baby's tushes here on these two pictures. And if you see that your baby's tush doesn't have a straight line, sometimes it deviates like that, sometimes it becomes like a V or a Y shape. Those are two indications that something may be misaligned in the sacrum or in the baby's pelvis. And these are things that can be corrected with chiropractic. Sometimes when the babies begin to walk, you will see that their toes go in or their toes go out like that. Sometimes these are also indications that something might be wrong in the baby's hips. If a baby starts to develop a flat head, that's usually an indication that they're not moving their neck properly. And it is something also that chiropractic has a great success with. And then the last thing I want to show you is babies that have torticollis. And you can see this baby on the right, these two babies on the right is the same baby. Her name is Ivy. And this is a typical case of torticollis that happened from a really traumatic birth. This baby on the left, his name is Roman. And you can see his torticollis is similar to Ivy's, where the head is tilted to the side and it's actually stuck like that. In Roman's case, even when I was hanging him upside down, his head was still tilted to the side because of how much spasming of the muscles of his neck there was. And both of these babies did awesome under chiropractic care. Here's Ivy at the end of her care. But we feel that if we can get to these moms and adjust them during their pregnancies, we could possibly have saved these babies from having the traumatic births that they had. And so you can be happy to know that if you're getting adjusted, your baby is going to have less chance of this happening.